Well, good afternoon, everybody. Thank you for joining us today. I'm just going to start with just a little bit of housekeeping, just to get that out of the way, and then we'll launch straight into things. So if you can just please keep your microphones muted throughout the session. We'll be doing a Q&A session right at the end, so I'm just keen to keep background noise to a minimum. So if you can just keep your microphones muted. You can use the chat function to make any comments and to ask any questions, and we'll take the Q&A right at the end of the session. If possible, if you're directing your question to a specific speaker, if you can just put that in the question or in the chat, and then we know who to address that to at the end of the session. Okay, the session will be recorded, so just as long as you're all aware of that. Okay, great. Next slide, please, Phil. Okay, I think you can move on to the next one after that, Phil. Great, okay, so yeah, welcome everybody. It's great to see so many of you joining us today. This is the latest in Health Innovation Northwest Coast series of Excel in Health sessions, and today's our focus being on NHS procurement. So I'm Kevin Moreton. I work in the Innovator Support Team at Health Innovation Northwest Coast, and I'll be chairing the session today, but you'll be hearing mostly from our expert panel because they're our subject matter experts today. So it's good to see lots of familiar faces at the session today, but for those of you that might not be familiar with the Health Innovation Network and Health Innovation Northwest Coast, I'll just a quick introduction. So Health Innovation Northwest Coast is one of 15 health innovation networks situated across England. We're commissioned by NHS England and the Office for Life Sciences to effectively act as the innovation arm to the NHS in England. Each health innovation network works within a distinct geographical area of England, and our specific remit is to accelerate adoption of proven evidence-based innovations across NHS care systems. And we do this to improve patient outcomes, reduce health inequalities, and to also drive economic growth through innovation. One of our primary objectives is to help health and life science businesses to succeed and to ensure that the NHS is able to access some of the innovations that you guys are developing. So that's the reason why, one of the reasons why we put on these sessions. Next slide, please, Phil. So Health Innovation Northwest Coast supports the discovery, development and deployment of innovations and improvements in health and care across two integrated care systems, and that's Cheshire and Merseyside and Lancashire and South Cumbria. So you can see on the map there that the area of England that we cover. We understand the needs of our health system and are well placed to broker innovative solutions to our clinical partners across the two regions. So why procurement? Well, we've been running these Excel in Health sessions for some time now, and one of the most commonly requested topic areas is NHS procurement. Previously, we've run sessions bringing procurement and commissioning together, but I think we feel that procurement in itself is a big enough topic on its own, so we've decided to devote this session today to procurement. So why do you want to know more about NHS procurement? Well, I guess for some of the reasons that you see articulated in that slide there. NHS procurement can be confusing for suppliers. There are lots of potential customers. There are a variety of different mechanisms and processes to try and navigate your way through and engage with. Next slide, please, Phil. So selling to the NHS can be tough, that's acknowledged. The sector is vast, with over 200 hospitals and more than 700 primary care practices. It's a system that employs 1.7 million people and treats over 1 million patients per day. The sector is risk averse. Historically, it's taken an average of 17 years to fully adopt new evidence-based innovations across the system. And it's governed by complex procurement and commissioning rules with multiple layers of decision making. However, the NHS is innovating and changing at a faster pace than ever, and the system requires innovative new products and services to enable it to continue this, to meet this ever-increasing demand. The NHS 10-year plan positions procurement as a core enabler of NHS transformation, and new marketplaces and open frameworks are emerging designed to empower both providers and yourselves as suppliers. Next slide, please, Phil. So with that in mind, we've convened a number of subject matter experts today for you to help you to navigate through some of these complexities and to try and help you to understand the system a little bit more. Just to run through the speakers we've got today, we've got Laura Davies, who is the Director of Supply Services at Value Match. Laura will be providing us with a general overview of NHS procurement and some of the key recent changes which you need to be aware of. And she'll also talk a little bit about some of the services that Value Match can provide to companies to help you through the processes. From NHS Supply Chain, we've got Leanne Joynes, who is a care pathway specialist for the North West region. Leanne will be giving you an overview of the role of NHS Supply Chain in procurement, outlining some of their key objectives and processes. Then we've got Health Procurement Liverpool. We've got Brian Burge and Colin Baker, who will be explaining the role of their organisation in supporting a number of key NHS trusts in the Liverpool region. So in previous sessions that we've run on procurement, we've heard from the team at Lancashire Procurement Hub, so we thought this would be a good time to bring in the team from Liverpool to get the perspective from the Cheshire and Merseyside region. And last but not least, we'll be giving you the views from Doug Hopkins from Value Match. So Doug has got some great success in navigating NHS procurement and selling products and services to the NHS. So we've invited him along today to hopefully share some of his wisdom and experience and pass on some of that to you guys today. And then we'll have a bit of a Q&A at the end of the session, so you guys get an opportunity to put some questions to our experts. So that's it from me. We'll get started and I'll hand you over to Laura from Value Match. Over to you, Laura.
Thank you. That's brilliant. Next slide, please. So just in terms of what we'll address today, I've just kind of done a little agenda there, which kind of sort of talks about key themes. I appreciate we've only got 10 minutes, so it's a bit of a whistle stop, but hopefully I'll just pull on some key points. It might prompt some kind of thought processes, and then if there's questions at the end, I can take them, or if after the session as well. But yeah, my name's Laura Davies. I currently work at Value Match, so Director of Supply Services. So Value Match is a small SME, and we provide sort of procurement support to primarily the education sector, but my background previous to Value Match was working for NHS Shared Business Services for 12 years, sort of running the sort of consultancy health services team. So kind of got a good understanding of the sector and the challenges and kind of all things public sector procurement. So yeah, just to talk a little bit about kind of who we are, what we do, and the things that are there on the slide. Next slide, please. So just a little bit about Value Match. I won't say too much, but essentially we are, yeah, as I said, a small SME, very focused on kind of driving the sort of social value, sustainability, procurement aspects to everything that we do. We're very sort of keen on trying to kind of use procurement as that lever for change, you know, to drive good practices, good contracts, you know, putting good contracts in place, doing good processes, and also making sure that the benefits come through in those contracts, particularly when we're talking about social value, sustainability, and all those things that go with it, as well as obviously maximising the value from a monetary perspective as well. So very much kind of procurement consultancy focused. That is our kind of our focus and our driver. Next slide, please. So yeah, just a bit of a summary, and also Kevin touched on it. You know, the healthcare ecosystem is vast. You know, the numbers that Kevin talked about are huge. You know, there's a lot of things. There's now a 10-year plan. You know, there's transformation going on left, right, and centre. You know, the sort of the ICSs and the ICBs have now fully emerged. You've got long-term plans. You've still got COVID recovery. You've got a huge amount of spend, and I think in many respects it's still quite fragmented. And there are still things where people are kind of going about doing things kind of maybe not in as cohesive a fashion as they could. So, you know, you've got a lot of things going out, a lot of moving parts, but equally, you know, a huge amount of opportunity if you can navigate it well. Yes, it can be challenging, and Kevin's also touched on that. But equally, there's a lot of innovation, there's a lot of opportunity. So there's a lot of, you know, things to kind of go after. I guess it's just about understanding how to go after it and how to engage maybe in better procurement processes, which is something that Value Match sort of help with as well. Next slide, please. So I think in terms of obviously key change, I'm sure most people on the call know about the Procurement Act. If you don't, I would advise having a look at Procurement Act 23. It's obviously the new world that we're all working in now that came into play earlier this year. The slide just sort of summarizes sort of key headlines, really. There's a lot of kind of things that have changed within it. I think the principles of sort of, fair treatment, equality, transparency are still there. But what we see is a reduced number of procedures. So we've moved away from kind of restricted, open, competitive dialogue, competitive engagement to an open and a competitive, flexible procedure. So in a way, more room to kind of move within those procedures. But equally, I think what that might bring as people find the feet with it is that, defining those competitive flexible processes where you can have a number of steps within a tender can be quite challenging as well. So almost kind of being given more opportunity and choice to do things differently almost maybe gets you to second guess a little bit more. And sometimes that is, that probably is what people are grappling with. There's the whole kind of single supplier registration on the what's called the central digital platform. So which is essentially find a tender now. And obviously the purpose there is that they're trying to get everyone to register in one place and not have to refill all that paperwork again. So when you navigate in procurements, everything's there and there's a basis for you to start from, and then you can focus on the kind of quality and the commercial aspects of procurement. We've moved away from sort of most economically advantageous tender to most advantageous tender. I think, obviously price is important, but value I think is depending on what way you look at it, value can be defined by quality, by finance. It's a mix of things, isn't it? So I think it's just about being cognizant of that in terms of putting your best foot forward when you're answering quality questions as well as kind of commercial questions as well. There's a big push around inclusivity of SMEs and reducing barriers for them to access procurements. And the pre-market engagement angle is kind of something that's really being pushed. There's now different notices that get issued at starts of processes to try and drive that engagement and get the SMEs more included and kind of I guess feel like they can be more included. There's difference around participation criteria and supplier debarment, essentially around kind of like the steps that suppliers need to fulfill from participation perspective. So in terms of, are you sound as an organization? Have you done, sort of, what's the word I'm trying to think of? Essentially, there's like key criteria and key questions that are always asked. So again, that participation criteria is just trying to define, are you sound as an organisation? Can you participate in this procurement? And then supplier debarment is around if you're not fit as an organisation, there's kind of steps and processes in place now more than ever around if you are on that debarment list, what then happens in terms of your participation in procurements, etc. But hopefully we're not going to get on that list. So it's kind of a moot point, hopefully. And then there's some changes around contract modifications, KPIs, and things that are now becoming more things that you need to define as part of your procurement process, or certainly the contracting process at the end. There is greater transparency, so that there is a lot more kind of emphasis on contract details notices, award notices, transparency notices, and things like that. So I think lots of kind of subtle changes. I think if you're a procurement person, you probably understand that a lot more. But I think from a SME perspective, if your supplier trying to navigate that can be quite challenging. It can feel quite full on. So I think sometimes it's just about kind of taking a step back, looking at the paperwork that you're issued if you want to participate in a procurement, and just getting a good plan in place in terms of how you need to attack it. And again, that's something we can help with if people need that. Next slide, please. So I thought this was interesting just on social value. Obviously, there's been an updated model. It fundamentally aligns to the model that once was. The 10% weighting is now mandatory from October 25 around social value. So what you are seeing in tenders is that people are, and have been doing for some time, asking questions about social value aligned to the model and these 5 themes that are on the slide. And I think there's a real push around responding to those questions in the right way and making sure that your answers are answering the question, which sounds really obvious, but equally that you can follow through on what you write down in your tender, and you can push that through into the contract and deliver the social value that you specify and state. So I think it's just one to kind of be aware of that, that is becoming more and more, and has been over the last several years, becoming more and more important. So yeah, I think just to flag that, that's all I wanted to say on that slide. Thank you. Other elements, you may or may not have heard of the Evergreen Sustainable Supplier Assessment. This is something that's in the mix as well. Again, it's essentially like a maturity matrix, so it's looking really at carbon reduction and modern slavery and things like that. It's not necessarily an evaluation tool per se, but it does come into some frameworks and some tenders, and it's something to be cognizant of. I think from my last check, it sits within Atomis, which is like an online portal, akin to all the other kind of portals that people probably know with and have engaged with. And it's again around kind of assessing your organisation across a range of criteria, and then essentially awarding a sort of a score, if you like. And then you kind of do it on an annual basis, and that gets factored into to certain procurement processes in different ways. So again, just something to be aware of, to kind of maybe research and engage with if you're looking to engage in procurement within the NHS, etc. Again, the matrix has been created to align with kind of NHS priorities, so that the targets for net zero and things like that. So that's why it's important. There are some exceptions around NHS supply chain frameworks and medicines tenders, but again, if you go away and have a good look at the Evergreen via the link, or not the link, but the strap line at the bottom there, you will get a good understanding of what that is and how that can potentially impact you. Next slide, please. So yeah, the next few slides are a bit more focused on kind of elements of procurement. So pre-market engagement, again, as I said, the whole focus here is about, refining the procurement, getting people engaged, improving specs, innovation, and getting people to identify risks early in the process, transparency, breaking down the barriers, making people talk before a process starts, because obviously that is when, a lot of good stuff can happen, a lot of development and sensible conversations can happen that then we're going to align to making a better procurement process at the end of the day. So just to flag that is definitely a push within the new regs, and something to be aware of. Next slide, please. Sorry, I'm conscious of time as well. Pre-qualification. So we've moved from the SQ. People know the selection questionnaire to the PSQ. So is essentially looking at a lot of similar things. It's meant to try and reduce this administrative burden. I think a lot of procurement colleagues will probably wonder if that's actually happening in practice. I think that I think there's still a lot of administrative requirements in the new Act, etc. You've got the central digital platform, and the strengthened kind of exclusion and debarment rules, and conditions of participation. So there are subtle changes again. We've moved to the central digital platforms, trying to amalgamate data. So again, it's just having that awareness of, you need to set your accounts up, you need to be ready if you're going to engage in procurement and stuff like that. Next slide, please. Dynamic markets, just a quick shout on those. Obviously, a lot of people will know DPSs, dynamic purchasing systems. It's changed now in the Act to dynamic markets. Ultimately DPSs were always open, are always open if they're under the old rules, etc. And are kind of typically used for sort of more straightforward goods and services. I think now in the transition phase, there are likely to be sort of higher value procurements and things that happen under dynamic markets. Very much around kind of, again, increasing the transparency, increasing the engagement, saying what you are doing and providing greater visibility. So it's just a subtle change that's going to come in. I think it will, as I say at the bottom, increase flexibility and transparency. There'll be more opportunities, but you'll have to look for those opportunities. And obviously, there'll be more things advertised that way. Next slide, please. Frameworks, again, Kevin alluded to it, I think at the start, around open frameworks and things like that. Obviously we're seeing changes around that, which is a bit of a shift. So again, it's just being aware of that in terms of kind of what happens when. We're sort of, PCR 2015, the old regs, but frameworks were kind of awarded and closed, and then it was a case of when the next iteration comes up, there's a chance. Now that's kind of going to be slightly different. So there's still some similarities there, but there's kind of this flexibility of kind of extending participation across multiple phases and things like that. So again, the transparency, the flexibility, that's where it's all coming from. I think in reality, if that happens, is kind of another part of it that we will see emerge over the coming kind of months and years. Next slide, please. So again, different procedures. I've touched on it. We've gone from kind of streamlined to 2 core routes. Again, I've been kind of using it in the last 6 months. I do wonder if it does reduce the sort of administrative burden. I still think there's a lot to do. So I don't think that is necessarily the case. But here you can sort of see some of the sort of key sort of requirements around transparency. There's more there's more notices that need to be published to kind of say when you're doing things and give clearer visibility of contracts. For example, if your contract's over 5 million, you need to share it. So just little things like that are important. But again, hopefully it will improve SME engagement. Next slide, please. And again, as just touched on, evaluation award, again, transparency, making sure that you're saying what you're doing and making sure that you're doing the right thing to unsuccessful bidders and successful bidders. I think, there's definitely a chance that SMEs and social enterprise will get more involved. Perhaps the processes are a bit more predictable and clearer. Again, I think it's just up for debate as to whether it actually reduces the burden. Next slide. I think that might be my last slide. Oh, right. Sorry, no. So really quickly on the page, essentially, we can support suppliers engaging in processes within the public sector. My background is obviously, as I said, we also can run procurement processes as well. We can do all the things that are on the slide. I won't go into a lot of detail, but happy to have a conversation with anyone offline or after if they want to discuss that. And I'll just pause there because I'm conscious of time. Thank you.
Thanks, Laura. That's great. You've covered off an awful lot there in 10 minutes, so appreciate you going through that. We'll move straight on to Leanne now from NHS Supply Chain. Over to you, Leanne.
Thanks, Kevin. Wonderful. Okay, so hi everyone. I'm Leanne Joynes. As Kevin alluded to earlier, I'm one of the care pathway specialists within the care pathway team. That's a dedicated team that actually only stood up just over 15 months ago, so relatively new in terms of a team, and we're rapidly growing. Okay, so as part of this brief overview, I just wanted to focus on 5 key areas really, so give you a bit of a flavour of timeline, scale of operation, vision, strategy, and a little bit about our commercial and customer engagement functions, including a little bit about innovation. Next slide, please. Can actually skip past that, please. I'll cover most of that. Okay, so in terms of timeline, many of you will be aware of the multiple changes that is NHS supply chain. So in terms of legacy, our journey began pre-2006 under NHS logistics. In 2006, DHL was awarded the contract, and as part of Lord Carter's 2015 report, that highlighted a significant issue with variation in terms of procurement, which led to, in 2018, the operating model under what was SCCL was stood up, and the term category towers was formed. In 2023, we're actually all insourced again. So as it stands, we are now as one. So we have a category, the category commercial directorate, customer engagement, and another of other functions within the business. Next slide, please. So in terms of scale, so we manage 8 million orders annually, 600,000 products approximately, around 142,000 order points, and 18,000 locations, which, as you can appreciate, is massive. So that's around 30 million lines picked across several national distribution centres, but really key to identify that this scale enables us to deliver value and consistency for the NHS. Next slide, please. So just to bring to life our vision, so it's really simple in terms of we want to ensure that we make it easier for NHS to put the patients at the centre and absolutely first in line at everything we do. Our strategy focuses on buying smart, supplying right, and partnering expertly. We've got 7 enablers that drive this. So we've got category management. So that's what I touched upon. So in terms of the categories now being all in-source, we've got e-commerce, agile logistics. We've got end-to-end visibility in terms of that data piece, business simplification, partnering and data strategy. Next slide, please. So in terms of that commercial function, I just thought it was worthwhile just taking a few moments to take you through that. So we've got, you know, a massive commercial function that has a wealth of expertise, but we've also got experienced clinical expertise within the business. So we operate across a wide product range. Our products are grouped into 4 medical categories that actually is just merged into 3. So you'll see on the slide that rehab and community was separate to med-surg. They've now become one. So we've now got 3 medical categories, 2 non-medical categories, and then that covers over 134 awarded products and services in total. So really the aim of that, we want to reduce barriers and complexity by providing dedicated resources that guide innovators through that procurement process, as long as our NHS partners. We also create routes to market, such as the dynamic procurement system. So at the minute, we have had a few DPS programs go through, but they're predominantly within the medtech space at the moment. So that means that innovators can reach NHS buyers faster. That's the hope of that system. And externally, we collaborate with partners such as the NHS Innovation Service. We work really closely with health innovation networks across the system. And that means that we're really able to share expertise in a lot of the national programmes. So we work really closely with Department of Health and Social Care as well as NHSE. So we've got that real joined up approach. Next slide, please. So in terms of engagement, so our engagement model includes dedicated teams across acute, non-acute. I sit within the care pathway team, which is part of customer engagement. So we have 7 care pathway specialists. We've got 8 clinical care pathway managers who are all clinical in terms of background. At the moment, their background is nursing, but across a number of specialities. We're all aligned to the 7 NHS regions, and we've actually within the business got over 80 clinicians that have got a wealth of expertise. So it's not just nurses, we've got cardiac physiologists, we've got physios, we've got a number of clinical colleagues. So that's really to ensure that patient needs remain at the centre of everything that we do. We've also got a dedicated voice of the customer team, and that's really instrumental in helping to shape some of those procurement decisions. So really important that we bring in that customer voice, and we're also starting to bring in that patient voice. So that's really great in terms of stories, good news stories, and really showcasing some of the outcomes that we're seeing. Next slide, please. So I'm going to use this slot to really shamelessly plug my team. So touched upon it briefly just then, but you can see there all your contacts in terms of those 7 NHS regions. Predominantly, my team are looking at how we can transform care pathways, looking at, you know, patient outcomes, how we can improve capacity, get down those waiting lists, really meet the needs of the NHS in terms of pain points that they're experiencing. So this is around being able to capture and report, you know, your non-cashable, so your real value savings. We're also working really closely with the Department of Health and Social Care. So some of you might be aware of the standardised value-based procurement methodology that they're now devising. So that will ensure that when we are procuring, we absolutely look at value as well. So there's a real switch in terms of that weighting, and the expectation is to be able to provide that evidence to support that, you know, any technology, any products that are being that are able to be added to frameworks, etc., do have that value piece evaluation attached to it. Next slide, please. And I think that's it. So just to direct you to a couple of links. So there's a dedicated care pathway team page within there, a number of value-based healthcare case studies that we've worked with our partners across the system. What I would say is just please reach out, and if you need any more information in terms of links into our internal teams, our innovation team, any support required, then we would really happily help you navigate this complex system as it is. And I will close there. Thank you.
Thanks, Leanne. That's great. You've really given a sense of the scale and the volume of the organisation there. And I just wanted to sort of follow up there that you mentioned that the supply chain is one of the delivery partners on the NHS Innovation Service. So just sort of let the innovators in the room know that if you know that is a mechanism that you can use to try and get support from the NHS supply chain, as well as the other delivery partners in the service, such as the wider Health Innovation Network. Okay, so next speakers, we're going to go over to Brian and Colin from Health Procurement Liverpool. Over to you guys.
Thank you. Thanks very much. Good morning, everybody. Thanks for taking the time out of your day to join our session. I hope it'll be worthwhile. My name is Brian Burge. I'm joined by my colleague and friend, Colin Baker. We've been asked to talk to you for 10 minutes or so about Health Procurement Liverpool, what it is, who we are, what we do, that kind of thing. So could we have our first slide, please? Thank you. HPL was created in 2022 when procurement teams from Alderhay, Clatterbridge, Liverpool, Heart and Chest and the Walton Centre all came together into one team. As you can imagine, that was fairly difficult. There were four organisations, 4 sets of corporate governance arrangements, at least 2 systems, and basically 4 teams who had quite different ways of working. So to bring it all together into one was I think quite a feat. I didn't join until towards the end of 2022, so I think a lot of the work had already been done by the time I joined. It wasn't easy. It was fairly difficult, and I think it's safe to say that we do still experience operational difficulties from time to time across our sites. However, we must have done something right, because in 2024 we were approached by Cheshire and Wirral Partnerships NHS Foundation Trust and asked to provide them with some strategic procurement support, which we did. And we're glad to say that in June this year, CWP loved us that much that they too beat their staff over and became full members of HPL, Health Procurement Liverpool. So now almost a third of the Cheshire and Merseyside ICB procurement trusts in that ICB receive their procurement service from Health Procurement Liverpool. Thank you. Next slide, please. We have influenceable spend of over £250 million. We're committed to supporting the ICB objectives to streamline contracts, improve quality, and importantly these days be able to demonstrate that we're getting best possible value for the money, the taxpayers' money at the end of the day, that's spent on goods and services. We've put there, what do we buy? In fact, we buy everything from CT scanners to ballpoint pens and everything in between. We're not involved in buying drugs. That's what pharmacy do effectively. Our ambition, and I think it's fair to say it remains an ambition, is to create a modern, effective and efficient procurement function, supports innovation and delivers the highest quality patient care. We feel as a group that we're a long way down that road, but I don't believe anybody really is 100% there in that respect. Next slide, please. Thank you. We've formed ourselves into category groups. We felt as though that would be a better approach rather than everybody being involved in every aspect of everything. So we formed 3 categories: digital and workforce, estates and facilities, medical devices and clinical consumables. Now, we're not saying that absolutely everything fits neatly into those areas, but we find that most of it does. We've managed to deliver some real benefits by adopting this approach. We've got strategic groups set up for each of these areas who meet regularly to discuss issues that arise, work together, collaborate on projects, and generally just share ideas. And we find that works really, really well, and we've delivered a lot of benefit as a result of doing that. Colin's team in particular has a product evaluation group that meets very regularly to look at new innovative products and ideas that come onto the market, with the aim of providing as good or a better quality service than we get now, but at the same time always with an eye on cost. So we find the category approach works really well. We're thinking at the moment of putting, well, we are actually in the process of putting a paper to our procurement board to consider introducing another category around the provider selection regime. We'll touch on that a little bit later on. Next slide, please. Okay, so all our opportunities are advertised via Atomis onto the find a tender service. So any companies who are interested in bidding for any of the contracts that we let, we would urge you to register with Atomis, and there's a whole sort of setup process there that enables you to receive information about contracts that you are specifically interested in, and not sending you information about stuff that you're not. There's something called CPV, which you may be familiar with. It stands for Common Procurement Vocabulary, and will enable you to set up your company's details so you will receive the appropriate contracts as they're let. Next slide, please. Thank you. We've put together here just a list of the framework providers, so you can see how wide and diverse they are. I think we've captured most of them, but these are framework host or strategic sourcing partners, as they're sometimes known. And what they're there for is to put in place framework agreements that can be accessed by the NHS and often the wider public sector. You know, as you can see, there's quite a lot of them. Some of them specialise more in other areas, but the framework agreements are there primarily to speed up, if you like, a little bit of the acquisition process. There are a number of different types of frameworks. There's a direct award framework, or there's a further competition framework. And the mistake our end users often make, we find, is they'll find a company, find out that they're on a framework. The framework has an opportunity to do a direct award, and they think that's all they need to do. So they raise a requisition, quote the framework reference, and say, you know, let's direct award this business. Not as simple as that, unfortunately, because although the framework agreement may put in place a facility for you to direct award, you will still be required to demonstrate value for money in line with your organisation's corporate governance arrangements. So, you know, end users need to be aware that because it says direct award, it's not quite as simple as that. Obviously, there are the other frameworks that will invite further competition, and we deal a lot with those frameworks also. Next slide, please. Okay, when to engage with us? As soon as you possibly can, because there's so many things that we need to be mindful of, not least the Procurement Act, not least the provider selection regime, which we've missed off this slide, I apologise for. but also we need to make sure we're compliant with the Trust's standing financial instructions and its scheme of reservation and delegation. We need to ensure there's a budget in place. We need to consider how long these processes are going to take to actually deliver, and at the same time be mindful of our own workload and priorities. Next slide, please. I think that was about all we had for you, I think. Yep. Thanks very much. I think we're going to hang around at the end and take some questions. Thank you.
That's great. Thank you, Brian. Thank you, Colin. Thanks, both of you. Really, really good to hear about the work that you're doing with the Liverpool Trust there. Okay, we'll move straight on now to hear from Doug Hopkins from Vital Hub. Trying to find the name of your organisation. Sorry. So Doug's had some great success with the NHS in terms of getting products and services procured. So we've invited Doug along today just to share some of his wisdom with you. Over to you, Doug.
Thanks, Kevin. Great to meet you all today. I'd just like to give a perspective from an SME's point of view. So Phil, if you can just click on, please. It's just to give you a view of Vital Hub, who we are. We're a Canadian-owned acquisitive company. I was part of In Touch, which was the second acquisition in the UK, and since then we've acquired 17 companies, and now we've got around 66 products. So it's quite a challenge for us to manage that through. So I'll just give you a bird's eye view, really, of what happens in Vital Hub. In 1 year, we've had 29 bids. We've won 2, lost 2, and we've no bid on 2, and a few are in progress at this moment in time. But we really look at the bids and then decide whether we should actually bid. Do we think it's written for someone else? But we do have a higher win rate when we actually go to bid. However, we do like to try and deliver on the frameworks direct awards, as Brian and Colin just mentioned a short while ago. And there are many frameworks, but they're a challenge to get on. So often we do sit behind the integrators, as I've mentioned there, Insight, Softcats, SDC of this world. And obviously there's G Cloud 15 that is out at this moment in time, and that's changed quite significantly in the value, as Laura mentioned earlier on, of what the procurement are looking for. So that's just a flavour of us. Next slide, Bill. Some lessons learned. I'm not preaching, I'm not talking down to anybody, but it's just what we've come across at my time at Vital Hub, and even when I was at BT, headed up BT Health. Should you bid? Have you created the need? Or are you following someone else who perhaps created the need and hence the procurement has come out? Is there enough margin in it for you? You could probably bid, but is your resources that you're taking up and trying to win that bid, is it going to be profitable for your business as you move forward? Are you trying to access a new market? So therefore you probably would take a bid and a lower price. And also, as an important, is can you actually deliver on the specification that's noted in there, or do you need to work in a consortia? I think quite often now we're becoming part of a consortia. We're either leading it or we're supporting the main supplier on it. And the second one is like, can you bid? Can you meet the requirements that they've set out in there? Have you got the right resources available at that time to actually deliver on the bid, or is it just not the right time? And can you subcontract, as I mentioned earlier? Can you support a leader? Can you work with those guys to do that? And then the other main thing is just plan. Make sure you give yourself enough time. Obviously, they're mainly short turnaround times, if you're not aware of them, to try and plan as much as you can. Always read review, because you're in such a rush, is get those answers down but then get someone that's not party to that bid to read it to see if it makes sense. And as I always tell our team is don't be afraid to no bid. Give us the reasons why you're not going to bid, because you know you're not wasting your time. And then the next slide. Oh, no, sorry, I dropped one off. So just a few comments on those. I think Laura mentioned it. It's like answer the question. I know it sounds really obvious, but you'd be surprised that certainly in our organisation, a few guys have just answered it. Yes. Can you deliver this? Yes. It's like explain what you're trying to achieve, and put yourselves in the seat of the person that's reading the answers. Would it make sense to them? Are you actually answering their questions that they can tick you off? Because you don't know who's reviewing the answers, so they move it. So really answer it as fully as you can. And I would always suggest, and again, Laura mentioned it earlier on, about the pre-market engagement. Get in as early as you can, understand what the requirements are, what innovations you might be able to bring to it, and try and help steer the conversation your way. Past experiences, when a bid comes out, it's very, very structured. They know what they want, and it's possibly too late for you to go in. And then again, just finally, when you review your documentation, does the answers make sense? Have you fully answered their questions so the person who's reviewing it knows exactly what your capabilities are? And they're just some of the lessons that we've learned, but we really are trying to move to frameworks as much as we can. And again, as Brian mentioned, there's a lot of frameworks out there and they're quite tough to get on. But I think essentially for SMEs, is get those cornerstones ready for procurement. You might have the best product or service, but if you can't sell it, if you can't get it onto procurement, if you can't get it onto frameworks, you're going to be very limited in how you progress within the NHS. And that's it from my side.
Great. Doug, that's great. Thank you. Some really useful insights there. So thank you to all our speakers today. What we're going to do now is just, I think Phil's going to organise our speakers into a bit of a panel, and then we'll just open the floor to some questions. We have had a few initial questions put in the chat, mainly just around things to provide links to email addresses and links to things like Atomis. So if they've not been listed in the chat, we can make sure that they're provided afterwards. But really, over to you guys in the audience now. This is your opportunity to put some questions to the expert speakers that we have. So please take advantage of this. If you'd like to put anything in the chat or just raise your hands, and then we'll come to you as you're ready. Do we have any questions? Seem to have a shy bunch with us today. Either that or you've answered all the questions.
Oh, to be fair, are they all on mute and camera off, which might
They should be able to raise hands. They should be able to raise hands. So
okay, it might be an automatic setting, but yeah.
Okay.
Oh.
Okay, we've got a question from Maxine. So if we can open the mic to Maxine.
Can you hear me?
Yes, we can.
Amazing, perfect. Look, I take there are many procurement entities comparable to HPL, for instance, right? Because it's probably one for each hospital or groupment of hospital, right? What we call trust. So my question is like, where can we find the URL to access the website for each of these entities? Because I guess there are plenty of comparable entities across the UK. So maybe the first step would be like, first, how to get like a list of all these entities, and second, like how to get in touch with all of them, or at least to be able to get on their website to understand what are the tender they plan for the future. Does that make sense?
Shall I? I'm happy to start.
Yeah, Laura, if you wouldn't mind taking that one. Yeah. I mean, from what you can understand, is there a single directory somewhere? Or so
it's really tricky because there isn't, unfortunately. I think what might be helpful is I wonder if there is well, there definitely is a kind of a map, or there'll be a link somewhere to kind of all the ICBs in the country, and that will then, I think, all the trusts that sit within them will be kind of listed somehow. So that might be a good starting point. But then equally, in terms of tenders, to the second point, not so generally speaking, when trusts tender or an organisation tenders, they will put it on a system like Atomis, like Brian mentioned, and it will go on find a tender. So everything goes on find a tender over a certain value, very low value, and then it points you towards another website, normally like an Atomis or a Bravo or like an e-procurement portal. So you won't necessarily find tender opportunities on trust websites because that's not how it works. So it's a sort of two-pronged question. I think if you want contact details and kind of to understand the trusts that sit within an ICB or an area across the country, you can get those lists and we can share them. I'm sure they're fairly easy to get.
That'd be great.
But what it won't show you is all procurement opportunities, what you've got to do for that. That's more about relationship building with the right people in your area or the area you're trying to get into, and then making sure you see what opportunities are coming on find a tender. So hopefully that's helpful. I'll try and have a look for the ICB links now, Horst.
So if I understand, there is no like centralized platform, and there is no centralized platform even at regional level, right?
Well, so there is a centralized platform in Find a Tender. So Find a Tender is the platform where all procurement opportunities are identified. They have to go on there if they're above a certain, I think it's £10,000 or £12,000. So the majority of things go there, and then it will direct you to another website generally where you can then access all the tender documentation, see if the opportunity is right for you. So I'll share some links in the chat to try and help with that.
That'd be awesome. Yeah, thank you.
I think Doug and Brian have probably got some contribution to that as well. So Doug, if I can come to you first.
Yeah, thanks, Kevin. We are linked into a portal. So we've got a word search that comes up with all of the opportunities, and then they will refer you to which, whether it's Atomis or another portal to actually apply for. So we use an intelligence portal to summarize, funnel that down, and then we have to register at those portals. So.
Thanks, Doug. Brian, you want to come in?
Thanks, Kevin. Just in response to the request for a list of organisations, there used to be and I've just been looking very quickly on the internet now, and it's still there. It's a company called KALTZ, KALTZ, and their website is kaltz.co.uk, and they publish a directory that's circulated around the NHS and other people. I think you can buy it, and it just has a list of all the trusts, all the departments, all the managers' names and contact details. Now, I don't know what it would cost you to buy that, to be honest, but I would have also thought there should be a way of getting this information via NHS England. If you're really struggling, have a look at KALTZ, KALTZ.
Thanks, Brian. That's really helpful. I'll move on to the next question, which I think is from Joanne Hall. Joanne? Joanne?
Hello, everybody. My question is, yes, thank you. My question is for Leanne. Thanks, Leanne, for your presentation on NHS supply chain. It was really insightful. I have a question about value-based healthcare and care pathways and the progression of digital health within our NHS landscape. My question is, how does NHS supply chain embed this into current established frameworks as a measured value add? And I think measured as the key word.
Yeah, so at the minute it's a little bit sporadic, if I'm honest, but that's I know I briefly mentioned earlier, but we're working with the Department of Health and Social Care on their standard assessment methodology. So that is going to be, it's being piloted with 15 organisations at the minute. So it's providers, should I say, so trusts out there are using that in terms of their tendering activity. It's due to launch in March, so it will be published. So there'll be access to that then. But we're trialling it on a number of our current frameworks internally. So we're working really closely with that team. So what that will mean is that we're going to be evaluating for value at 60% rather than the 40%. So what we'll be asking suppliers to provide is evidence to support that their product or service or technology absolutely meets that value-based healthcare criteria, so that you can demonstrate what that patient outcome looks like, if there's going to be a reduction in bed days by changing to that product, and it will need to be evidenced in terms of real life evidence. So it'll be evaluated as part of your non-financial questions. Does that all make sense?
Yeah, that makes perfect sense, and that's really insightful. Thank you, Leanne.
No problem at all. If you want any further help, then do reach out.
Thanks, Leanne. Thank you.
Thank you.
And I think we've just got time for the one remaining hand up, and that's from Darren Sleuth. Darren, over to you.
Hi guys, thank you. I don't really know who could answer this. It's kind of just my overall feeling. So I'm an innovator. I'm part of the NHS Innovation Accelerator programme. So I've been through the whole due diligence process through NHSE, Department of Health and Social Care. We sit as an outlier in terms of what we've able to do as a solution from our research at Cambridge. And so I think for us, I'm trying to struggle whether we even go down the procurement frameworks, because you can't tender it out to 2 or 3 different people. It doesn't exist. We've got the patents around it too. We've got the evidence base. It doesn't exist. So for someone like me, how do I approach that? I don't see a framework that kind of fits within our remit, because we cover quite a broad thing. So we reduce staff sickness, we reduce patient infections, we prevent ward closures, we align with net zero, we can replace ventilation, all with one system. So it's kind of estates and facilities, but clinical. And so where we've got an implementation stage on a few trusts, they just do as a sort of tender waiver, as far as I can understand. And I don't know how they process that, but we definitely don't go on into any sort of frameworks. What advice could you give me in terms of what my next step should be?
Laura, would you mind taking that?
Me, did you say?
Yeah.
Sorry. Yeah, no, sorry. I thought you said Colin. Sorry, I misheard you. No,
yeah,
it's fine.
I'll come to you in a second, Colin, if that's okay.
So it's a tricky one. So the single tender waivers is an interesting point. I mean, that will happen in the NHS all the time. It probably shouldn't happen as much as it does, but reality is it does. Essentially what that is, procurement or finance kind of saying, you've kind of come to us too late, you've implemented the solution, or you've kind of gone through some kind of short process, and we know you need it, and we're gonna waive it and approve the spend. But clearly they can't do that all the time, because and generally they will only do that if there's a specific need, if it's urgent, or if there's a requirement that can specify as to why they've got to spend that money in that way, rather than doing a process. So that's interesting. I think I'm not exactly sure what your product is, sorry, but I'm fairly certain there will probably be a framework out there. You just need to try to work out which one. I don't know how extensive the research is that you've done. I think also there will be tenders that go out and that probably fit your services as well. That will be on Find a Tender. So yeah, without knowing the detail of what your service is, it's hard to kind of advise. But I'm happy to have a conversation around frameworks that you've tried or that hasn't worked out, or the ones you think are not, but beneficial, because I'm sure there probably is something out there.
Colin, have you got anything to add to that?
Yeah, I was just going to build a little bit on what Laura said there. So maybe go through the accredited framework list again, and maybe approach a couple of frameworks just to kind of see if they can maybe fit your products or your services within one of their overarching frameworks. And just to quickly touch on the waiver process, that has tightened up quite a lot with the new Procurement Act, because we do have to issue notices even over certain values for direct awards. So the trusts do now have to be really careful about what they do tender waiver, because they do have to publish those over certain values for the market to see, and therefore potentially the trusts could be challenged upon that. So the trusts do have to be quite assured that they are acquiring a service or a product directly that isn't available anywhere else, or there's a specific reason why they need to move quickly in order to procure that.
And I think just to really quickly build on that, on direct awards generally, there's definitely a move away from them. They are sensible and practical in certain circumstances, but I think by the time you've gone through a direct award process and done a bit of due diligence, you could have pretty much run a mini competition in the same period and done it in a more approved way and an evidence-based way that will do what Colin's saying. It will appease the kind of procurement function and the people in the trust to say we've done a little process. So it's just one to be mindful of, I think.
That's great. Thank you.
Thank you.
Brian, I noticed you did have your hand up. Did you want to add anything? Or?
Yeah, I briefly raised my hand, but are you saying that this is a new and innovative product that nobody else can provide?
Correct. Yeah. Worldwide as well. Yeah.
Okay.
If you don't mind, I think it's probably a discussion we need to take offline, because it's obviously
Possibly.
You need to know a little bit more about the particular innovator's product and offering. So maybe we can take that offline. I'm conscious of the time, and I don't want to take up any more of people's time. There's lots of resources and links that have been put into the chat, so please do take advantage of those. I'll just be getting permission from the speakers that we can share the slides, and I'm sure they will be agreeable to that, so we'll make those available. The session has been recorded. It'll be uploaded onto our website in due course, so it will be there as a resource. So I just wanted to close the session by thanking all of our speakers. It's great of you guys to free up your time and make yourself available like this, and I'm sure it's incredibly appreciated, and I know I appreciate your time. So yeah, thank you to everyone, and I'll bring the session to a close. Thank you.